I originally grew up in Traverse City, Michigan, from a medical family. I knew kind of early on in undergrad that I wanted to be in medicine, and I also did some engineering background, so it kind of got me into the surgical field. I fix a variety of general surgery problems, and I usually try to fix them in the most minimally invasive way possible. For me, a standard patient that I see on a daily basis might involve getting their gallbladder out or having some sort of abdominal wall hernia that needs repaired, or other soft tissue or masses that we don't know what they are yet, but they need excision. A lot of patients that I've seen in my training that had pretty significant abdominal wall hernias that were debilitating. They weren't able to do what they previously wanted to do, both in their hobbies and their career. A surgery that took maybe several hours in a couple days recovery in the hospital, and when I saw them in clinic, they were a completely different person. I'm Matt Madion. I'm a general and minimally invasive surgeon, and I'm passionate about taking care of my patients' problems in the most minimally invasive and effective way possible.